program like that, that's great, but they don't really have very many of those anymore. So then there's also people getting on different kinds of medication. So Ohio is one of the states in particular where there is so much stigma to outpatient medications. If you want to get on Suboxone, if you want to get on methadone, that's great, but you're not sober. So we tell people, I don't tell people, but I did years ago, I used to tell people, well, you're not really clean, you're not really sober because you're on these medications. So if you believe that addiction is a chronic medical condition, then sometimes a chronic medical condition requires medications. So if we believe this is true, then we have to believe that some people need to be on medications. But there's a whole segment of the treatment community that believes it's not true and wants to dictate to other people what it is. So I would say for any parent that's interested in trying to look into a treatment facility, what are the modalities that they use? What are the outcomes that they have? What kind of aftercare is there? If there's no aftercare, if you're just taking your child, putting them somewhere and plugging them and putting them back in the same place, that's not going to be super successful. So we've thrown outpatient in the United States underneath the bus. We used to do outpatient a lot. And outpatient has really good outcomes in a lot of places because you're teaching your loved one how to navigate all the things that trigger them while they're at home. So intensive outpatient, if you can get it, is sometimes the best bang for the buck. So that's a whole other subject. So I went through a rehab facility. The rehab facility I went through was so terrible they closed it. It had such poor outcomes. I went and lived in sober living run by the Salvation Army for 4 years. So now you wouldn't even be able to stay there a year. I lived there for 4 years till I could get enough money to get my own apartment. I started college, like all these different things. I lived right where I used to use drugs, like literally right where I used to use drugs, right in the same spot. And I didn't use because I had reasons for living. And so what we're finding, particularly in the United States right now, is that young people and people are so disconnected. You know, it used to be you had a job at General Electric or Procter & Gamble, you woke up, you had kids, you had this reason for living, you had these reasons for doing things that got you up every morning. If you ask people under the age of 30 what gets you up every morning, there is nothing. There is nothing. What are the things that drive me? What are the things that keep me going? We're so disconnected. I can sit and literally on my phone scroll through the same 4 apps for 2 hours and wonder what I just did with my time. I look at Instagram and feel less than, look at Facebook, it's a curated image of what life is and feel bad about myself. And so you could see where a drug that makes you feel wonderful would be something that you might want to buy into. So, and that's the problem with opioids, they make you feel really fucking good at first. But they have diminishing returns. Then you have to do more, and then eventually they don't necessarily work for you. And when you're using drugs, it's really hard to get off that that little hamster wheel once you've started. So a lot of what I do send naloxone through the mail to people, but a lot of what I do is I just listen to people. And that's really hard. Human beings find it really hard to listen. So you're sitting here, we're having a conversation, and you're already formulating what you're going to say to me. You're already thinking about the advice that you're going to provide me with. That's not helpful. That's not helpful necessarily. If you're listening to a person who has various problems, whether it's suicide ideation or depression or addiction, a lot of times they just want you to listen and mirror back to them what you're saying. But as human beings, we don't like that. So that's where meeting with someone else as opposed to a family member, because the family members, it's hard, we're sitting at the edge of our seat. We're waiting for our opportunity to tell us exactly what I think you need to do. This is exactly what I think you need to do. Or friends, this is exactly what I think you need to do. So I work with strangers. Strangers contact me on the internet. I mean, I've returned up to 500 messages in a day. When I do media, like I was on the Today Show a couple weeks ago, I mean, it's constant, all day messages. And it's a lot. I mean, that's it's a lot of stuff. But that's it's sad to say that people in their local community don't have any access to services, and they have to tell all their personal business to some person they've never met on Facebook or Reddit. Some woman just contacted me today. I live in a small town, I was sexually abused. These are not things you should have to tell me to try to get help. Like, you've never even met me. Another person, my sister died of an overdose in 2015. Like, these are super, super personal things. But they're so willing to tell anybody because they want to try to get some kind of help. And I feel like I was kind of the same way when I was going through my process. So then So to talk about so I got involved in advocacy. I went and they started saying we should be giving out naloxone. This is before there was a national overdose crisis. So I had kind of had my children and was doing other things, and then I started getting contacted around 2013 by people saying, I wish I had access to naloxone. People were hearing about naloxone, but I wish I had it. And then I would say, well, I guess I could send it to you through the mail because I had access to it through various places. And so naloxone, for those that don't know, this is the fancy Narcan ones. So naloxone is a drug that, if you think of an opioid is flowing through your brain like a river, it's a dam that temporarily stops it. And so when we started, the little vials of naloxone that we used to give out were like 33 cents a vial. I mean, now these are, for my city, these are $150 for this box. So we've had a few things happen. We've had an opioid crisis and we've had price gouging by the drug companies. And then also the controlling of the access. And I'm not saying that as like, I'm a liberal from California. I'm saying that it's a truth. Like that's a true statement. They've raised the prices over 400%. They've created new formulations of this drug specifically that are more expensive. So there was little units that they used to have. They were $4,000 for Narcan. So they gave a bunch out for free, and then they said now we're charging them $4,000. So that's really unfortunate. So I started sending naloxone through the mail, and then people were using it. And the thing is, I wasn't sending a lot of explicit instructions. I was just sending it through the mail, watching a YouTube video, and people were using it. And so what we find is, if you give people naloxone, the opportunity to use it seems to arrive. And so, these are the nasal units. I usually do the injectable intermuscular units because they're super, super cheap. I don't have the ability. I got a box of this stuff donated. I usually give these away. Usually at the end of these presentations, I give this to someone. That's illegal, by the way. I'm committing a misdemeanor when I give it to someone. So the fact that I'm distributing naloxone without it's like a pharmacy license or something like that, it's illegal. But I guarantee you, if a parent or someone asks me for this, it's going to get used. So is the law wrong or am I wrong? So that's kind of where we're at. And I don't think that is super revolutionary, it's just something to think about. So I was said at lunch today, I've been waiting for them to arrest me for 4 years, but they haven't arrested me yet. I think it's because I keep showing them a few pictures of my kids on the internet, and they're like, oh, we can't send her to jail. Just look at how cute her kids are. So I don't even do this for a living. I work for city government. I do something totally different. This is like my life, my passion. I got naloxone tattooed on me. I got a lot of the tattoos I have are to cover scars, so I almost lost my leg to an infection. I've had 34 abscess scars. I have scars all over me. It was really hard for me to integrate back into society knowing I had done all these terrible things to myself. And being able to contribute to the health and well-being of other people gave me some meaning in my life and gave me some ability to sort of feel good about the community and the community that I lived in. And so now, cutting back, bringing it back to coming to Ohio, I mean, from here, I was shooting heroin living here in Westchester, and now Ohio is the epicenter of overdose in the United States. It's one of the leading states of overdose deaths in the United States. And there's a few, Dennis can talk more if you want to talk to him about the reasons why, but a lot of it has to do with the people in charge are not allowing access for the average person who's actually going to use naloxone to have it. So if these units are $150 at the pharmacy, a person working at Taco Bell making $10 an hour is not going to buy these. The government should be giving them out to people. So no matter what you think about private industry or whatever, someone should be spending money and giving these out. We need to have these. We need to have them on our homes and have them on our person. We need to have these. We need to have access to these. And the first sets of people who should have those are people who have users in their home and people who interact with users on a daily basis. And treatment facilities should have them. And sober living facilities should have them, and jails should have them because people come out and they overdose and die. And people in recovery should have them. We all should have these. But the question keeps coming up, who should pay for them? And a lot of the time, and especially in the state of Ohio, they're paying for them, but they're paying for them for the wrong people. And they're not getting out to the general public. So that's a huge issue in particular. And then also, the naloxone needs to not be prescription. It needs to be something you can just walk in and buy. So the fact that this is behind the pharmacist counter makes it so people will not come in and purchase it, even if they have the resources. Excuse me, sir, I'm a junkie. Can you help me out with this medication? And they can refuse to sell it to you even if it's legal. So there's a provision in the pharmacist code that was put in there for Plan B, where the pharmacist did not want to dispense Plan B, which some people say is an abortion pill, but either way, it's 4 birth control pills that's morning after pill. There's a provision in the pharmacist code that says you don't have to dispense anything to anyone. You don't have to sell that. So they can refuse to sell this to you. They can refuse to sell you syringes. So even in a capitalist society, they can refuse to take your money. They can refuse to service to you. So now we've created a tiered system. If you have the internet and you have access to a credit card, you can purchase syringes online, you can buy your heroin online, you can buy all these things online. But if you're the average person who doesn't have all those things, you're put in a whole nother tier. If you don't have insurance, you're a whole nother tier. If you don't have the ability to drive 40 miles to the city, to Columbus, to sit in a place